Welcome to today's health segment, where we will delve into the world of neglected tropical diseases and their causes. Joining us today is Jean Bosco Mbonigaba, the Acting Director of Neglected Tropical Diseases and Other Parasitic Disease Control Unit at the Rwanda Biomedical Center. Welcome to our studio, Mr. Mbonigaba.
Thank you, Olive. Thank you.
Speaking of neglected diseases, can you start by briefly telling us what are neglected tropical diseases and why are they considered neglected?
Thank you very much for that good question. This is normally when you hear this word neglected, you may understand that there are diseases that are neglected. Therefore, people afraid about this disease neglected, which is not the case. This normally got this name because of the history. Many some diseases were paid much attention to compared to others. This included the three big diseases, mainly HIV, TB, and malaria. They are well funded, many research around those diseases, and the different initiatives around those diseases. Then WHO, the international organization in charge of health, tried to put other diseases that were neglected in somehow in research, in capacity, in funding, in community awareness. Try to put them into one group, and now we have 21 diseases under that umbrella of neglected tropical diseases, just to advocate, to make more awareness and more efforts so that we can also pay attention to them and eliminate them and alleviate sufferings of those diseases to those affected.
So what factors contribute to their prevalence in a certain area?
Yeah, mainly as they are different, 21 diseases are quite different in terms of transmission of the disease, in terms of symptoms, in terms of prevalence. Different things are really differentiating those diseases. And mainly, when you look at Rwanda, in our country, we have the most common ones. And from them, we can now have specificities around their transmission and even how to prevent those diseases. And here we can probably say intestinal worms. Most of the NTDs are transmitted through poor hygiene, sanitation, and the poor quality of water. And those are mainly including intestinal worms. We have schistosomiasis, we have scabies, we have podoconiosis, and the others. But in addition to those diseases, we have those others which are transmitted by snake bites, for example, causing envenomation. We have dog bites causing rabies, and also we have teniasis from eating pigs which are not well cooked.
So you just mentioned some of the neglected tropical diseases found in Rwanda, but what are their symptoms and long-term effects?
Thank you very much. Normally their symptoms are somehow different, but let us start by intestinal worms. When someone is really having intestinal worms, the most common symptoms is like he will feel like he will be having this intestinal pain. He may have nausea. The person might have even cough, different symptoms and signs of that disease. But also he may be weak and not even in classroom. The problem of those diseases, the kids are not really performing well in classes, and because those intestinal worms took the nutrients that helps to develop their brain. They took those nutrients, and then the people will really develop this mental retardation, which is really critical to our kids. And it's also behind the stunting issue that we have here in Rwanda. We can see that district having a high burden of intestinal worms and having as well this high stunting rate, which is really critical to our country. That's why the government is putting more efforts to eliminate those diseases so that we can at least also alleviate the symptoms and the other consequences of those diseases. And let's say for snake bites, you have envenomation, and some people may even go for amputation of one of their limbs. And for dog bites, we have rabies, which do not have any cure, any treatment when it develops. Yeah, many things, many consequences related to those diseases. And lastly, podoconiosis, leg swelling of the lower limb. When one is working or in their routine activities like farming, they are farming without wearing shoes. Now the soil particles may enter their skin, and there is inflammation and destruction of the lymphatic system in the lower limb, causing the swelling of the leg. And you see someone with disability, difficult to work for his family. It's very critical. It has really a big impact. That's why the government is investing in this, those diseases, so that we can eliminate them by 2030.
Since we have these diseases, some of these diseases in Rwanda, what is the current status of these diseases, specifically in Rwanda, in terms of statistics?
Thank you. Let's start by the most common ones, intestinal worms. Even when we were young kids, we used to have in the countryside some traditional medication when we were feeling bad in the intestine. These intestinal worms are common, and we are having 41% of prevalence. I mean, in 100 people, we have 41 which are infected by intestinal worms. And for schistosomiasis, the one transmitting different wetlands or water bodies, we have at least 1,000 cells which are endemic to this schistosomiasis. For podoconiosis as well, we have around 6,000 cases affected by lymphatic, this leg swelling, podoconiosis.
You touched on a very important point while you were explaining that the government is deploying efforts to combat or to prevent these neglected diseases or to eradicate them. Why not? What efforts are being deployed by the government of Rwanda to combat these neglected diseases? Thank you
very much for the question. Sure, the government, they are called neglected tropical diseases, but for the side of Rwanda, the government is investing in those diseases. They're no longer neglected. They have never been neglected in Rwanda. So the efforts have been made. Now more investment are being made so that you can reach the country commitment of eliminating them by 2030. Where those diseases will not be really a public health threat, a public health problem to our community. This means it will be at the threshold, at the minimum threshold possible, where they're not really causing harm to the community. So the government is really investing a lot. Let's start by probably treating adults even. Treating for intestinal worms. Now the treatment of adults were not really performed before 2020. Now in 2021, because with the survey, the study that have been conducted, we saw adults are now more affected than kids. That normally kids below 16 years were the ones who were used to be receiving deworming periods during at least twice a year during campaigns. Currently, since 2021, now the government is treating adults as well during maternal child health week campaigns, so that at least, because they were serving as parasite reservoir, transmitting or contaminating kids who were dewormed, who were treated. Therefore, the government is treating now adults. This is one of the investments. Secondly, in terms of podoconiosis, let's say, the government have been put in place some treatment centers so that people can have access to services, mainly in terms of treating those cases which in the past they were not really treated because the services were not really present in health facilities. A part of procuring drugs for those adult community, we are also investing in water sanitation hygiene. I think the water access is now at a good level. The same with sanitation, I mean toilets, latrines are really improving, which means the government is investing a lot to have those diseases eliminated. The same with other diseases like dog bites, snake bites.
So that is the part of the government and those all efforts. But what is the contribution of residents, or what should residents do to prevent those neglected diseases?
That's a good question as well, because as the residents of some communities, different villages, we have a great role to play. It's mainly our part. The elimination cannot be possible without residents' contribution. Number one is the individual or the person to wash his hands, to regularly use the toilets, even prevent some poor sanitation practices like open defecation. It's individual people, residents, to prevent any of the poor behavior or bad behavior, which are really contributing to the transmission of those diseases. Let's say for dog bites, it's the individual person, the owner of the dogs, who needs to vaccinate them so that he prevents or she prevents the transmission of rabies. Let's say for snake bites, normally those who are farming let's say in areas where we have snakes, need to have preventive measures like having boots and the other protective equipment so that they cannot really get bitten by snakes. So I think residents individually has a great role to play. First of all, get to know that those diseases, how they are transmitted, and then what is their role now to prevent those diseases. And if now infected, what would be the next steps, mainly in terms of seeking care, because all the facilities in Rwanda and the hospitals are providing services to those people who are affected. Now, individual people, everyone, every Rwandan should really seek care to the health facilities to even have checkup, regular checkup of intestinal worms, of Bilharzia, and other entities, so that at least we can reach the country commitment of eliminating them by 2030.
We have come to the end of today's health segment. Thank you for sharing your insights, and thank you for dedicating your time.
Thank you very much.